Hello, everybody. It's another week. To say that it's been a roller coaster week is a complete understatement. I could say it's been a horrible week, but equally, it's been an incredibly inspiring week. Everybody knows, and most of you would have seen the Channel 4 feature last night where the old vicarage at Starlingborough was included in it. We can't get away from the realities that everything that we game plan for a bad situation, it's happened, and it's sort of as bad as we had planned for. We had been relying on being able to use asymptomatic staff to go back into the home, which seems completely logical, to just purely support individuals who've tested positive. We've been completely blocked from doing that, and it's not a goer. So anyway, what I do want to do first of all is to give you masses of reassurance that we've got this very much under control. The issue we were saying was that if we actually now have to bring, as we are going to do, some very, very senior staff in from elsewhere within the organisation to support the old vicarage for a period of literally 3 days now until staff who have been isolating start to return from work, then what it means is that those staff are not necessarily available to work elsewhere in the organisation for 14 days. So all the time it's depleting our ability to respond. I've decided that I don't want to go into too much detail. We've had a long conversation about it on the Cobra meeting today, and I'm going to cut from here straight into the bit of the Cobra meeting where other people also sort of became involved in the discussion to give you a fuller readout on it. But what I can say is, as at this time, none of the individuals who have got COVID are showing us massive anxieties. Most of them are asymptomatic, more or less. Two have got slightly sort of issues, but we're right on top of it. All the data's coming out of the home all the time. We're looking at it all the time. And the staff, equally, we are supporting staff at home in their own homes as necessary with welfare calls or wellbeing calls. And at the same time, where they need some food drops or whatever, we're making that happen. Our staff are absolutely critical to everything that we do. The guys who are working in the homes, they are providing absolutely safe care, and I can't thank them enough. And equally, we are doing other functions through the system and the platform, without which I don't know how we could possibly be doing this. So we are in a good position in a difficult set of circumstances, which, as we said, we knew was going to take a 3-4 week period while people go off and then people start to come in. We expect generally staffing levels to continue to sort of fall away, but at the same time it will start to tip probably in about a week's time. But anyway, I'm going to wish you a really great weekend and next week, and please don't worry more than you will obviously worry, but we really want to give you every reassurance, and my daughter's in there, as some of you would have seen, notice, who know her, so she's in there. She also has it. But anyway, over to our Cobra meeting from today. Thank you very much. Stay safe. So basically, we're at level 5 of business continuity, which is our highest level for the old vicarage. But we don't have the ability to deploy asymptomatic staff back into the home, because I think we would challenge it legally, but we don't have time to challenge it legally. We believe there's a legal argument that says that they should go back in. But I think, it's been made pretty clear to us by everybody that they all consider we're breaking the law. And we basically have a situation where actually you can't blame anybody other than perhaps bloody Public Health England, because they actually brought this in, as far as I understand. But you can't blame North East Lincolnshire CCG, because effectively they're being told by Public Health England, if you deviate from this, you're going to break the law. What I think is really disappointing, we had understood from North East Lincolnshire CCG the night before last that they would try and make some staff available to us from their Focus Kick associated sort of organisation. And I think we were working with them yesterday in the morning. What do you need, etc. And I think we were asking for a very modest amount of staff that we were asking for. And then we got out of the blue. We just got at 4 o'clock in the afternoon, having had this conversation in the morning and lulled ourselves into a full sense of security that actually they were going to help and be positive and all the rest of it. We just got a carte blanche which says you've got to go into special measures, otherwise we're not going to support you. Well, I suspect that's because they haven't got any staff. Let's be truthful. I suspect they haven't got any staff and they're not telling us, and that this is sort of like a default situation. Oh, well, just put them in special measures. And then what would happen? Well, what would happen then is Presumably, they then flood it with agency staff who would be the inappropriate staff, who would then create massive issues around the individuals. And what came out yesterday, that if you're an individual with COVID who has learning disabilities, you are at risk 30 times the national average to die. Well, you know what? Put agency staff into our homes and you're immediately ratcheting up the risk to those individuals of dying, or having a worse outcome than's there. So, you can't blame the people involved in delivering these messages to us, because they're just the messengers. This is flawed policy. And today I see that the minister of whatever she's called has tweeted was it Anthony? What's she called?
Wheatley. The Minister of Health and Social Care, Helen Wheatley.
Helen Wheatley. She's tweeted today or said today that they're ramping up testing in the care homes. Well, that's great. But let me tell you something. Ramping up the testing in care homes, ramping up the testing across the country, it's fine, but it doesn't solve the problem. It gives you a new problem, as we know. You suddenly realize that 65% of your staff are asymptomatic. Okay, so when you ramp up the testing, that's great. But if you think that's the solution, you're completely nuts. This is not a solution. It's part of a solution. It says, now you know what the problem is, you build strategies to create solutions. There are no strategies being built to create solutions to this. The rest of my case.
I think it's important to say as well that the reason that people with learning disabilities are 30 times more likely to have poorer health outcomes with COVID, some of that can be explained by underlying health conditions, but not all of it. And a lot of it is to do with those complexities. It is about the fact that people don't recognise that they're unwell, or they're unable to express that they're unwell, which compounds the fact if you then put a member of staff that doesn't know that individual, you're just compounding that problem.
Absolutely, and that was a point that Professor Giles Glover, that we've worked with previously, he made that point very well last night, I thought.
The people that know these individuals like the back of their hand and know the nuances and complexities in much more detail are unfortunately unavailable because they're asymptomatic. So I think it's a difficult situation to be in, given that we're having to do the best. And like you've just said, I'm going to be unavailable for other people now as well that might require some additional support because of this. So it's not ideal, but we're doing the best that we can do. And I think, I'm incredibly confident that we're going to get through this situation and people are going to be absolutely okay.
Because at the end of the day, the only thing that matters is protecting the individuals who are in our homes. That's all that matters at the end of it, and our staff, who are just amazing, who are going over and above. And the fact that we've got staff who are asymptomatic at home, some of them have actually got somebody else looking after their children, so they could come back in and are itching to come back in to support the individuals in the home.
There is a solution to actually get through this without actually causing more heartache, more risk, and so on. And it just seems ludicrous that we're caught up in the middle of a Mexican standoff between PHE, between the poor local authority, between CQC, and we are, and I say we, the individuals, we're caught up in the middle of it, where no one is able to pull the trigger and make a decision. I think this week's been a funny week for a lot of us, hasn't it? But for the whole organisation, because this report came out yesterday around learning, people sort of, more likely to die with learning disabilities, but for sort of underlying health issues. And unfortunately, we did have to, we had someone who died in our care, who had a long-term illness, who was too young, to be honest, and it was misdiagnosed. And what was really nice was, we had a nice service in the circumstances, but what was so nice was there was a load of staff who had previously worked for us outside the home. And, and some of them had worked with this individual from 5 years ago. And, it was the fact that they felt so invested in that person. And despite that time that had gone by, they still had that connection, that emotional connection. And I think, that's what this is all about. This emotional connection that we collectively are talking about, that we're collectively sharing. And, I think that's what it's all about.
There's one of the songs that we used for the celebration of the gentleman's life earlier this week. I think the words are very poignant for what we've been discussing. The first two lines are, "The higher you build your barriers, the taller I become. The farther you take my rights away, the faster I will run. We will not give up until this is done.